Next, I'd like to invite up Charlie Owens from NFIB. Charlie wishes to speak and supports the legislation.
Thank you, Mr. Chairman and members of the committee. My name is Charlie Owens. I am the State Director for NFIB, National Federation of Independent Business in Michigan. We're an advocacy organization for small business in Michigan and nationwide. And we are here this morning to support Senate Bill 897. Medicaid expansion was designed for the working poor. In a report or an issue paper from the Kaiser Family Foundation entitled Understanding the Intersection of Medicaid and Work, it says, as of December 2017, 32 states have implemented Medicaid expansion. By design, the expansion extended coverage to the working poor. And you've heard some percentages thrown out. The percentages that I managed to get from their website for Michigan indicate that 75% of able-bodied, I'll come back to that definition in a second, already live in working families, and 60% are working themselves. Able-bodied, in the context of their issue paper, are non-elderly, non-SSI adult people. So they try to take into account those that are on disability because of the fact they're getting supplemental security income. Since Medicaid was designed for the working poor, excuse me, then it shouldn't be unusual that there would be a work requirement in order to be a part of that program. Previous testimony has corroborated that the majority of the folks in Medicaid are already working. Unfortunately, that's being offered up as an excuse rather than an opportunity to bring more people into a permanent attachment to the workforce. We understand the concerns around able-bodied individuals, Mr. Chair, and we believe that in your substitute, you've tried to address that concern by looking beyond the traditional able-bodied definition that I discussed earlier, and also examining those situations where even though they may not be SSI, they may not be elderly, they may not be disabled by the SSI definition, that there could still be reasons such as being a caregiver, either to a member of the family or children, and other concerns, and I think that your bill goes towards addressing that. Let me just say that we've kind of got a unique opportunity here. The current economic expansion in labor market, unemployment being down, this is an opportunity that we may not have in a long time to try and move some folks who have not had a permanent attachment to the workforce into the workforce. We do a jobs report at NFIB for small business, and last Thursday was our latest study and release of that. Our members are reporting that labor challenges are the biggest issue facing them. Let me put that in context. For a long time, the three biggest issues facing our members were taxes, regulations, and poor sales. So those have moved to the bottom, and now finding workers has moved to the top. That's the first time that has happened since 1987. So we do have a very, very strong economy and opportunity. Our members reported 89% of those hiring or trying to hire reported few or no qualified applicants. 21% selected finding qualified labor as their top business concern, as I mentioned. 19% reported plans to raise compensation in response to the tight labor market. We throw out a lot of percentages when we have these kinds of issues. We talked about 70% are already working, 60% are working or in a working family, 60% are working themselves. So I kind of tried to drill into some of these numbers to get around the percentages and get to actual people. What I found, and again, all of this data is static, so we're using 2016 data here because that's the newest that we have. And I would suspicion these numbers get better as we move away from 2016 because of the economy. But we have a total Michigan Medicaid enrollment, roughly 2,338,000 individuals. If you take out children that are in one of the child health plans, you subtract out 937,000. That gives you a total adult population of about 1.5 million. If you take out those that are on supplemental security income or SSI, you take out another 275,000. I'm trying to get to this able-bodied number. And then if you take out the elderly, which I don't want to offend anyone, but according to the data people, that's over 65. So that takes out I'm not far from that myself, sir. That takes out 163,000, another 163,000 people. So you end up with about 961,547, roughly 1 million people, that would meet this able-bodied definition. Now let's assume, because now I have to guess, because we don't know until a work requirement is implemented, how many more folks would meet the exemptions that you've built into your bill to try to deal with those folks that have other reasons why they cannot work, such as being a caregiver, having an illness, having a disability not recognized as an SSI disability. Let's assume that's half, which I think is a big number. But let's assume that half of these able-bodied people that I've come to with this analysis would meet your exemption criteria in your substitute bill and be exempted from the work requirement. That's still 500,000 people. 500,000 people that could be working and establishing a permanent attachment to the workforce, helping Michigan job providers fill those jobs, and frankly, it would be, as anyone knows, the best program for a family that's struggling is a good job. And so I think that we need to focus on the people and avoid a discussion about the percentages. We've heard some of the reasons why we shouldn't do this: administrative complexity, cumbersome paperwork. Small business is very familiar with those concepts, and we sympathize. In fact, when we asked our members whether we should support this legislation or not, in the argument for not doing so, because we give an argument for the bill, an argument against the bill after we give a background, and then we ask a question. In the opposing argument to your bill, we pointed out you're going to have to do a lot of paperwork under this that you don't have to do now. Yet, despite that, when we asked them, should Michigan pass legislation that would require able-bodied Medicaid recipients to fulfill a work requirement in order to continue receiving benefits, 90% said yes. 5% said no, 5% were undecided. As far as the cost of implementing the work requirements that's been discussed, you yourself have said this has to be a cost-benefit analysis. I believe a review of the sub indicates that you've tried to bake in reporting back to the legislature, auditing functions to determine a cost-benefit analysis with regard to the work requirement. And we are happy to see that. So to conclude, we appreciate the opportunity to share a small business perspective, and we ask you to support Senate Bill 897.
Thank you, Charlie. It's a sick job that nobody has any questions. Thank you, sir.
Thank you, Mr. Chair.